All right, can you hear me now? Bueller? All right. Good afternoon, everybody. Thanks for joining in for last minute kind of pop-up town hall meeting. I will say that I'll give the credit to Leah Willis for suggesting I do this. I think I did this when we had our first positive COVID test employee in our independent living over in South Village, and it seemed to be well liked by the residents. So we thought we'd do it again with everything going on to try to provide a little bit of peace of mind and try to recap the memo and then let you know where we are now and then what the plans that we have in place moving forward. So I'll start off by saying we're not going to take any calls today. We're not going to take any questions. Everything that you need to know right now was in the memo that was sent out last night. There is no new information that I can really share with you today. We're just in the process of those plans from the memo, which I'll talk about in a minute. So again, we're not going to take any questions. We're not going to take any calls. It's just me and Daniel in here. Well, Randy was in here earlier, but he must have walked out. So we're going to just go through this and going to talk about some stuff and then do a recap and go from there. So as you know, we've had 4 positive cases as of now in the health center, 2 being employees and 2 being residents. I will obviously admit I'm not surprised, although sad that it happened. I'm not disappointed in our efforts. I just regret it happened, but as many people have said, and as I've said before, it was virtually impossible for it not to happen, and it was like dodging bullets every day. That's the best way I can explain it. It's just, it has become much more, I think, easy to catch it than it was before. I think that directly correlates with everything that we're reading in the news. Today, another record high hospitalizations of 871 people hospitalized throughout the state of North Carolina, 1,652 new cases in North Carolina. It spiked and it skyrocketed ever since the mandates were lifted by the state and the stay-at-home order. I'm not here to debate if that's right or wrong, but it directly correlates with the new cases, and obviously you're seeing it happen in other communities and now, unfortunately, in our health center. I think at first people were very scared. They had their guard up, very cautious. And I would like to think our workers, I know that our workers are like that at work, but people go out after work and they go home. And I just think that it's just our society and how we've become not accustomed to this, because it's kind of hit you in the face again, but how this is very much still real, and other things that maybe happened in the news the past 2 to 3 weeks, this kind of got pushed back. Well, now it's back, and it's hitting really, really hard. So, and now it's hit home, unfortunately. So, again, with 120 residents that we serve in the health center every day and 250 employees just in the health center. Just in the health center, we have 250 full and part-time employees that come in and out of health center 24/7, 365, nonstop for 103 days. Been doing it for 35 years. It's like Russian roulette. You're eventually going to get hit. And that's what's happened. So what we have done, I've never felt more prepared for anything in my life. So we have been very proactive in everything we've done and had planned. So now all we have to do is be reactive to what happens. So we are in that stage now. We're reacting to everything that's coming to us, and we are just implementing our plans. So what's happening today, we're having all residents, it's about approximately 100 residents that are going to be tested today, and all staff that had direct contact with either the 2 positive residents or the 2 positive employees. That's called priority testing for the employees, and that is the suggestion and the recommendation from the local health department to start with those employees, see what happens from there, and then you can branch out from that part. As I mentioned in the memo, the I didn't mention, but I'll tell you, we had 15 residents we tested that we identified were directly in contact with the first caregiver that got sick, and 2 of those 15 produced positive cases. Like I said, if there's any good news out of this, that they were roommates. So they were in the same room together. They can be isolated in the same area together. So I'm hoping that's a good sign that maybe it was contained within that room and it has not spread greatly. I am not so much concerned about the residents being positive as maybe some of the employees, only because the residents are checked daily. We check for symptoms. We know if there's any change of condition, we jump on it just like any other thing. The staff members are screened every day. They answer questions, but they're not checked 1/18th the amount that a resident's checked every day. So if we have more positive cases, which very well likely may happen, we're going to test about 150 people today. We'll continue doing the same things. We'll isolate the residents if there's any positive cases in our isolation unit, and we'll quarantine our employees at home for 14 days until they can produce a negative result and then come back to work. So that is a very basic plan, and it's just the plan for everybody within this industry. But the things within our community that's unique is our isolation unit, and then our infection control nurse, and the staff we have that's helping do this with the contact tracing, and shift managers. If you're not sure what a shift manager is, they oversee each shift. For an administrative side, they do all the staffing, so the nurses don't have to worry about that. So they've been a huge help in tracking schedules. We have dedicated assignments, which means in a perfect world, and it's not exactly perfect, but we have the same residents, the same employees take care of the same residents each shift they work. So that's why we only had to test 15 employees for the part-time employee who worked 3 days, because this employee is not a floater, and that she doesn't go to Clayton Wing, then C Wing, then up to the rehab hall, and then back down to B Wing. They see the same people each day. And that's really the model we're going to in our home care, but it's going to be much more detailed. But that's just a good example of why we only tested those 15. And hopefully, but now we have to test everybody since 2 residents were exposed and tested positive. So that is our goal. Our goal is to prevent the spread of the disease and in the health center, and then isolate it, find everybody that was infected, quarantine them, isolate them, get them better, and then start over. So again, that's where we're at. 2 employees, 2 residents, and more tests to be conducted today. Family members were contacted via email or either phone call that we're doing tests today, and that if any results come back positive, the family members will personally be contacted. We'll be here all weekend waiting on that. The lab is out here, I think, actually now working on that. So we had these test results back within 24 hours, but we only did 15. It may be Sunday as late as Monday if we get 150 test results back. It really depends on how fast they can process them based on how many tests they have. The backlog, obviously, 1,652 new cases. It's a large amount. It's a lot. So we'll get those back as soon as possible. I will provide everyone, as I always do, a blanket memo that goes to all staff, residents, family members, and our board of directors, and I usually customize an email in there specifically for staff, specifically for Stewart Health Center residents. Stewart Health Center families, and specifically for our board of directors. We have created an email listserv that goes to our independent living families, and an email listserv that goes now to our independent residents. That's something we started this week. You will receive notification 2 ways on any kind of memos moving forward. There'll be a hard copy that'll still be placed in your mailbox, and if you have provided us an email address, Daniel has provided that, and we have, and that will be coming out from a do not reply email address. I want to tell you why we do that and the basis behind that. We send out, Daniel, how many emails total, if you had to guess? So almost 900 emails we send out to family members, residents, and staff. There's no way on this wonderful earth that any of us could answer all the questions that came back if there were all those type questions that come back to one email address. So I personally send out the emails to the Stewart Health Center family, so that I feel that's my role as the executive director to hear from me and to answer personally. I realize Carrie Corley and Leslie Smith are the two leaders down there, but I'm ultimately responsible for all of it, so I want them to hear it from me, even though Carrie or Leslie may be doing the actual work back there. So I send that out, as I think is important. I send it out to the staff, personally for me and the board. Daniel sends out more of a blanket to y'all because we have the memo, and to the family members. And when we have it set up to have the comments to come back to Springmore, please, please, please be mindful to keep the questions only to the memo. We've just started it this week, and we've been inundated with random things about dining and maintenance and housekeeping. The comments for springmore.org from that memo is specifically related to this memo. So if it's a question you have about the memo or about something that pertains to the memo, we'll answer it. If you didn't like your fish the other night, no offense, we're probably not going to answer that. That is pertained just to the memo. So please tell your family members that as well. We're going to put that in our next send out. We've been really good. Families have been really good about just asking pertinent questions, but we've had some residents that have just sent kind of general inquiries that are just, that's not the basis for the forum for it. Nothing has changed. You know my number. You know Daniel's number, Randy's number, Jennifer's number. We're all here still to help. So just call us or email us if you need anything. Just don't use that platform for it. All right, so that's what we're doing now. That's what that's our plan for today. And our plan for the weekend is to just basically wait for test results. And once we have test results, we'll go from there. We'll update everybody, and then we will see what the health department recommends we do next. As I mentioned before, we have extremely wonderful representative at the health department who's a nurse who's been assigned to us, and he has been awesome. He's going to be out here today helping with the tests, and he's helping guide us and direct us and do everything from the perspective of what the health department needs. So they're the experts on that. They've handled these, so we're working with them within our staff and our own policies and procedures, of course, our medical staff as well. So just to recap everything from the memo, we had our first employee in the health center started feeling symptoms on the 9th of this month, and she did not work since the 9th, and the next day she got tested on the 10th and produced a positive result on the 16th. A lot of people have asked why it took 6 days for them to produce results. I cannot answer that. I have no idea, other than I know she went to a CVS Minute Clinic, and perhaps they're testing slower. Maybe they have been backlogged. I have no idea. But when someone wants to get tested, they can go wherever they like. They can go to their doctor, a minute clinic, a urgent care, a drive-through. You know, she did this on her own, which is great. She felt symptoms, so she went out and got tested. So thankfully, upfront about it, she gave us the results as soon as possible. The good news was she had not worked for 6 days. So she had been out, so almost half her quarantine was already over with. So she was out. But once we informed the health department about that, they suggested we contact trace the residents she had direct contact with, and we test them. So we did that. Tested 15 residents. She had the assignment for the last 3 days she worked, and as I said earlier, 2 of those residents tested positive. During that time, we had another employee not feeling well, started developing symptoms, went home, stayed out the next day, got tested, and produced results within 24 hours, and they came back positive. So that's how the second employee got, I don't know where she got exposed. She works in the health center, so that's how the second employee came about. So the testing today correlates with, again, required staff that we've identified that had direct contact and working relationship with the 2 positive case residents and positive case employees. So not all 250 health center residents are being tested today. That may eventually happen, but today we're prioritizing testing based on the recommendations of contact tracing of positive cases with the residents and the 2 employees. All of the residents are being tested. So every resident at the health center will be tested, minus the ones that were already tested the other day that produced test results. And then that will be our ground to see where to go next. We have a lab, a private lab that's doing this for us. They've been very good. They come out and help do the test, and we have a portal that we log on to, and it shows us our results. We got a phone call last time personally, Carrie did, saying there were 2 positive cases. It was kind of like a heads up, and then all the results are on the portal, which show the 2 positive cases and the rest of them negative. So that's how we'll be identifying that this weekend. We'll just kind of just sit around and wait for results. So anyway, in the meantime, those 2 employees are obviously out home quarantined. They're both doing well, I'm happy to say that. And both residents that were tested positive, they're both in the isolation wing, and they are both doing well. Neither one of them had symptoms, which is good but kind of scary because we're going to test 100 residents today that may not have symptoms, and we get more positive test results. It's a little scary to know, but I think we need to know. It's the only way we're going to isolate it and know how to be proactive and put our plan of action in to rid it and to hopefully minimize it moving forward. So that is what we're doing. I can't speculate about months to come and fall. I do say I think everything that's going on now may be an indicator of how things may continue if things continue to loosen up and as we go into the winter months, but hopefully that won't be the case. I just think that you're going to see and hear this a lot more as you did 4 months ago when this first started happening. It was the hot news of a nursing home getting an outbreak, which is, just be mindful, outbreak is 2 or more cases. We have 4, but 2 or more is all we have. 2 or more is all it takes for it to be an outbreak. And that's considered in the health center as well. So it's the Stewart Health Center. It's not Springmore. Just be mindful that the Stewart Health Center is a separate entity under Springmore. So just like can't think of anything now. Springmore is the Stewart Health Center is what our license is under. So that's the health center part, which the Department of Health and Human Services and local health department, that's what they really zone in on. So anyway, that is where we're at. I don't have much more information other than just trying to clear up the memo, trying to recap again what happened and letting you know what our plan is moving forward. Again, I still feel very confident about it. We're doing all we can, and I think most of y'all realize that, and y'all have expressed that, and that means so much. It is very trying, and it's very stressful, but knowing that y'all feel confident in what we're doing and knowing that y'all realize we're doing all we can, and we've done a very good job so far, and we're dedicated now more than ever to do what we have to do. It's very comforting for not only myself but for the staff because they know that y'all care and y'all have confidence in us, and that's always been the most important thing to me by a resident. And I got one of the nicest emails today from a resident just saying that exact thing is a huge booster for me and for staff. That goes a long way. The bonus we got from y'all, or the gratitude bonus, was wonderful, and it was very much appreciated and well used with my family to do something fun for a night. But your words of appreciation and confidence are priceless, and that's what I thrive off of, and a lot of us that do this as a profession, this is where we excel in times of stress. And in the ninth inning, 2 outs, playing in the World Series. Maybe a cheesy scenario, but that's what that's kind of what we strive for and we live for. So we're in it, and we're going to get through it, and we'll continue to update you. I pray that I can report good news, and things will continue to improve. They will eventually improve. Please know that. But don't be alarmed. Don't be shocked if you get a memo over the weekend and there's more positive cases. Just be realistic, the way I've been, that we have 120 residents and 250 employees just in the health center, and they're here, there, and everywhere. So that's reality, and we will do the best we can with that and continue to contain as much as possible. So y'all please be safe. Y'all please be careful. Please be mindful of where you go, who you see. Make sure you wear your mask, wash your hands, cover your mouth when you sneeze. We need y'all to stay healthy. We have a much larger group of y'all than in the health center. It just spreads much faster within a congregate care setting in a health center than it would in independent living. So y'all stay safe, stay healthy. As soon as we have updates, we'll provide it for you. And I hope y'all have a great weekend, and we'll talk to you soon. Thank you.